The diagnosis of Alzheimer's disease strikes fear in all of us, but there may be some hope from early detection. Neurologist Dr. Yogesh Shah joins us now with patient Doyle Scott. Good morning, gentlemen.
Good morning, Angie.
Good morning.
Well, Dr. Shah, help us understand, if you will, what early Alzheimer's looks like in patients.
Yeah, Angie, we are very happy to be here. We're on the partnership with ASI and Biogen to promote and talk about this disease early diagnosis. So when we use the term early Alzheimer's disease, it refers to mild cognitive impairment, or MCI, and also refers to mild stage of the disease due to Alzheimer's disease. And then a lot of patients ask me, how do you differentiate that between normal aging? And the main difference is at the speed of process. Early Alzheimer's disease progresses very fast, and there can have other changes which affects their day-to-day life, like they can have symptoms of repeating the same story again and again. They can importantly forget their important appointments, not just once in a while we may do, but many times. And then as the disease progresses, this can affect their functionality, meaning they can affect their how do they cook or not cook properly, whether they can manage their finances properly or not, and also even occasionally driving.
So Doyle, share with us what symptoms you first noticed, or perhaps your family members noticed.
Well, my family members noticed it first, but I had trouble staying organized and on schedule. That was uncharacteristic for me. I'd had a successful career as a principal, as a teacher, and as a superintendent. And when you have jobs like that, you have to be very organized. So I was organized, but I was having trouble keeping track of what I was supposed to do and when I was supposed to do it. And more importantly, I wasn't remembering things. My wife would tell me things that were coming up, and I didn't remember that she had told me anything. So we knew that we needed to talk to our doctor about it. Our doctor suggested that we get in with Dr. Shah, and he was able to confirm my early Alzheimer's diagnosis and started me on Leqembi. I'm glad to be on Leqembi. It's helped me to continue to enjoy my family time and to enjoy the things that my wife and I like to do, including traveling and other things.
Well, that is really great news. So, Dr. Shah, how does Leqembi work?
Yeah, Leqembi has a dual mechanism. It's an FDA approved. It's infusion given through intravenous way. And by dual mechanism, what it means is it removes the amyloid plaque. That's the protein plaque which happens part of the Alzheimer's disease. But along with that, it also removes the proteins which are toxic to our neurons, our brain cells. And by this dual mechanism, it not only removes the plaque, but it also helps to slow down the process by removing the proteins which can help and hurt our brain cells or our neurons.
But these people who are qualified for this medication have to be in that early stages?
Has to be very early stages, because so it has to be early, and by early, what it means is has to be mild cognitively impaired or very early stage of the disease. Once the disease progresses there are 3 stages for Alzheimer's. It's early, middle, and late or severe. As the disease progresses, then Leqembi may not help the patients. Earlier the better.
Excuse me, I'm sorry. Can you send our viewers to a website where they can learn more?
Yeah, it's a simple website. It's leqembi.com, which is LEQEMBI.com, and there is a lot of good information for patients, for their care partners, and even for those physicians, providers who are listening. Even for providers, it's a very good website.
Dr. Shah and Doyle, thank you so much for sharing this important information.
Thank you.
Thank you for having us.
And we'll have more Lifestyles right after this. Stay with us.